back to my channel. So as you can see, I have my tube back. I got it placed on the 25th of May, and I just want to talk to you about how it all went. I've had a lot of endoscopies over the years, and I'd have to say by far this was the worst one I've ever had. The doctors, I've spoke previously about how important it is to advocate your needs and tell doctors exactly what helps you and what doesn't help you, and but the one thing that you can't really do is make them listen. Now I reiterated my needs probably about 4 or 5 times on this day when I went to have my tube placed, and it basically fell on deaf ears. Now, the ironic thing is that when I had my tube placed, they told me that they could do it 2 ways. Now, as far as I was aware, you could only place your NJ tube via your gastroscope through your throat, and then obviously they then pull it through your nose afterwards. But I got told on this particular day, oh, you know, we can go through your nose and we can do it this way. I said fine, like they could try, but I explained about my nasal septum on my left side of my nose was really narrow, and I don't think they'd even get the scope up there because they had trouble last time getting the crocodile clip type things, like the tweezer things, through my nose in order to get the tube. So they were like, okay, we can try. So they basically got a very small bottle of like local anesthetic spray, and they started spraying it up my nose. And I'd explained that, you know, I have to have quite a lot of local anesthetic because otherwise it doesn't work. So anyway, she decided to use this whole bottle, like this tiny little bottle, it was about this big, and she basically sprayed it evenly up both sides of my nose. And I was like, I could feel the air still going through my nose, I could feel everything. Yes, it kind of, you know, helped a little bit. You know, it kind of felt like my throat was slightly numb, but it wasn't overly numb because, like I said, I could still feel things. I could still feel my swallowing. I could still feel everything. The only problem that I had was it seemed to make me really wheezy. And the ironic thing is I actually saw my old gastric doctor. He walked through and I said hi to him, and he was like, asked me if I was okay. I explained to him that, you know, I felt like I couldn't breathe because of the fact that she just squirted a whole bottle of local anesthetic up my nose, and he just went, oh right, okay, and he walked off. When she came back to tell me that she was ready, I explained again, probably for like the umpteenth time, that just giving me midazolam as a sedation doesn't work for me. Now, bear in mind, I had cardiac ablation done in 2018. They gave me 6 milligrams of midazolam in total for that cardiac ablation, and it was like, give me the midazolam, back in the room. Like, it's literally, it does not do anything to me. It doesn't even touch the sides. And I explained that because of the way that the gastroscope is and everything like that, they would physically have to give me the midazolam, plus they would usually give me a small dose of fentanyl, so that I was still very conscious and still very aware of everything that's going on, but it relaxes me enough to the point where I'm not fighting or I'm not having any issues, and I can relax better. I said, and they also spray a lot of anaesthetic in my throat. Now, by the time she came back to me, the anaesthetic that she squirted up my nose, for whatever effect it had, it wasn't effective anymore. It completely worn off. And I explained this when I was there, and she said to me, okay, well, there's an issue here, because you said you wanted sedation and you've ticked that you wanted sedation. However, if we go up your nose, we can't give you sedation, because in order to have sedation, you'd have to be on oxygen, and we can't put a scope up your nose and put you on oxygen at the same time, because otherwise we won't be able to get the scope in. So the only other option to give you sedation is to obviously go down the throat, and that way you can still have your sedation, because we can put the oxygen through your nose. So I said I wanted to do it the old-fashioned way, give it me through the throat, because at the end of the day, I knew they were going to struggle with my nose anyway. And I thought, after thinking about it, I thought, if they do go up my nose and they can only go up one side, that's going to be a lot of trauma to my nose, and then I've got to have a tube sticking out of it, and that's just going to cause more problems. So I was like, just do it the old-fashioned way, go down my throat, do it the standard way. They were like, yeah, that's fine. Again, I reiterated in front of the doctor that midazolam alone does not do anything for me, and that they would have to squirt a lot of local anaesthetic in my throat. So she said to me, open your mouth. She said, don't worry about it, it's fine. Open your mouth. So she basically squirted my throat twice. Literally twice. Like, pump, pump. That was it. I spray more than that when I have a sore throat with a Benzodine, like, spray. It's like, no, I'm sorry. That does not do anything for me. Like, you spray it, it doesn't work. I was like, hasn't touched anything. But I couldn't really say anything because no sooner did she spray my throat, they put the thing in your mouth to keep your mouth open and compress your tongue so that they can get the scope down. And obviously they had the oxygen on me, and she's like, right, lay down, relax, I'm just going to give you sedation. And I'm laying there and like, I couldn't feel anything going in my arm at all. I remember she pressed on my cannula, if though she was putting something in it, but I didn't feel it go up my arm. I didn't feel any different whatsoever. And I'm sitting there thinking, this is weird. Like, I am totally conscious. I am totally with it. I have no idea why this is not working. I could feel my throat and everything. So by the time they went down with the scope, I could feel absolutely everything. The first time with the scope, I did what most people usually do. They concentrate on breathing. It was harder for me to concentrate on breathing because they'd sprayed a lot of anaesthetic up my nose originally. And obviously when you stimulate the nose with anaesthetics or anything else, it can make the vessels in your nose swell. So of course it made me feel like I was bunged up a little bit. But I could still feel my nose. It just made me feel a little bit bungy. So I was like, okay, I'm going to try and concentrate on breathing through my mouth, which is very difficult to do when you've got a scope going down your throat, but it was the only way that I could try and do it. So try and concentrate on breathing, and they went down, and they said to me they were still using, I think they didn't say the laryngoscope, but they were using a different scope instead of the gastroscope that they should have used. So anyway, they went down, and every time they tried to go down with the tube by feeding the tube with the scope, as they were moving the scope out of the way, they were coiling the tube or flipping the tube back. Now this tube is quite a flexible tube, but at the bottom of it, that's on the inside, it's quite rigid. So obviously that was flipping. They have to pump air into you so that they can see where they're going with the scope. The first time they went down with the scope, I didn't really feel a lot. Like, I could feel it in my throat and it made me cough a little bit, which is normal. And I just concentrated on breathing and it went down and I was fine. So they pulled the scope back out and the tube came with it. And as they pulled the tube back out, I got this intense pain in my actual stomach, like not like my abdomen, but where my stomach would be situated in my body, like my actual stomach. And I was literally, I felt like my chest was crushing and my stomach was like gonna burst. I was in so much pain. I actually was writhing in pain. I was just like, ow, that really hurts. And I was trying to concentrate on breathing. The nurse was like with me, trying to concentrate on breathing. The doctor was talking to another person, if though the other person was doing everything. And he was basically just guiding them. And he was like, okay, we're going to go back down again for another attempt. And just as I'm like going out, as he shoved the tube, like the scope back down, that intense pain of air came flooding back again. And I was like really upset. Like, I kind of like, the pain was so bad, I just burst into tears and I was like shouting ow as best I could until I couldn't shout anymore, because obviously the scope was going past my throat past my vocal cords, and I was literally trying to get in a comfortable position, so like almost like the fetal position, because normally if you're in stomach pain you get into a fetal position, you roll up like a ball. I couldn't physically move. I had two doctors on one side of me, I had a nurse and two nurses above my head, One was suctioning mucus and stuff from, obviously, because you drool because of the thing in your mouth. And they were suctioning that off, and I had like one of the nurses dabbing tears from my eyes because I was crying at this point. And it was just horrendous. And he was like, he kept on going down with the tube and then pulling it back, and then this tube was coming back with it, and I was like, God, this is so painful. And obviously I was alert and conscious and nothing was working, and it got to the point that not only was I gagging on the tube and this tube, because this at one point coiled in my throat and I was choking on it, I was actually bringing other things back because I was literally like balking so much. I was literally gagging so much. I was in a lot of pain with my stomach. And they basically weren't as gentle as I thought they were going to be. They literally were ramming it down and pulling it back up and ramming it back down and pulling it back up. To the point where they were having so much trouble, they eventually turned around and said, get the gastroscope ready, because they were having so much trouble. Every time they went down this and tried to pull back out, this tube would literally coil. So anyway, they were getting the gastroscope. They were getting the gastroscope ready in order to go back down again. With the gastroscope to make it a little bit easier, because they could tell that I was struggling. I tried to tell them I was choking, I was gargling, so I couldn't really breathe very well because I was gargling through all the crap that was in my actual mouth, in my throat. They were only suctioning what came out. I was crying, so they were wiping my tears away. I was writhing around in pain from the air and everything else, and obviously them moving the scope around my bowel and everything. And then after that, they decided to go down again with the same scope, and as they were pulling it back out, he was like, yeah, we're definitely going to need the gastroscope. And then he was like, let me try one more time, and he was halfway out and then went back down again, which obviously caused more intense pain. And then eventually he was able to get the tube in place and then pull the scope out without it causing this to flip or this to come back out. So they asked him, does he need the gastroscope? And he said, no, it looks like I've managed to get it now. We don't need it. And then he pulled the tube out. But luckily for me, as they pulled the tube out, anything that was blocking my throat kind of came out a little bit with it. So I was like, fine. And by that point, I was in so much pain. I had been through so much trauma with it. I was literally sobbing. And the nurse was like, oh, you did so well. Like, you coped really, really well. I know that wasn't comfortable and things like that. And I was like, you have no idea. Like, you literally have no idea. You didn't give me the sedation that I would normally have. You didn't spray my throat. You weren't acknowledging the fact that I was gargling on mucus. You didn't acknowledge the fact that I was writhing around in pain. You didn't really do anything. My saturations were dropping, so they kept on trying to tell me to breathe, which is easier said than done when you've got a load of mucus at the back of your throat. So by the time they'd finished and they took everything off, and the tube had been taped into place and everything, I was distraught, like literally distraught. They took me back to recovery, and I think the nurse was so concerned about me. She actually came to see me twice to check on me to make sure I was okay. And I remember saying to her, like, I tried to tell you that I was choking on whatever I was bringing up. I said, on a lot of mucus. I said, my throat is really cloggy. So she asked me, did I want like a sick bowl to kind of spit things into. Anyway, she couldn't find one, so she got me like a plastic, like almost like an ice cream cup, like box. So she got me like a paper cup, and told me to use that. And obviously there'd been a lot of trauma. I had a blood rash right around my eyes, all around my face here. I had like a blood blister rash. My eyes were all bloodshot. My voice is still really not very good, and it's been almost 2 weeks now. In fact, it's been 2 weeks since I had it done. And it's took this long for my stomach to calm down. Obviously the first 24 hours after having your tube placed, you're supposed to just do flushes on your tube, and then my feeding rate regime was to do so many mils over 20 hours, then increase it by 20 mils and do that over 20 hours, and then go on my normal feed rate for 14 and a half. And I was barely able to do my lowest rate feed over, I think it was like 12 hours without intense pain. So I ended up like that for a few days. I had like a day on feed, then a day off feed, then a day on feed, then another day off feed, and it was like I can't physically, every time I did a flush I was in excruciating pain, to the point where I ended up staying off feed. Now I went in on the Wednesday the 25th to have my tube placed, and on the 27th I went away for a week, and I didn't have any rest time in between that because obviously there's 3 kids, myself and Phil, and the animals to sort out. So I had to sort the animals out for kennels, I had to sort all the packing out, I had to do everything, because Phil was still at work as well, which wasn't helpful because I had to do everything. So my stomach was in agony, I was trying to do feed, I got really upset and frustrated. I then went on holiday for a week and I was really poorly the whole time I was there because like I had no time to rest. I was extremely tired. My body had gone through hell, just to have the tube placed. The feed wasn't working. It was kind of making me feel really sick and it was causing a lot of pain. And then on top of that, halfway through the week, I ended up with a UTI. So yeah, I wasn't very well throughout the whole of my holiday away. Luckily I didn't go abroad or anything, like I only went to Wales, but I was like really, really poorly, and it was just like a really stressful holiday for me. I wish I was able to enjoy it better. I did have a good time, but you know when you just wish you'd like had better time because you just weren't sick. So I kind of overexerted myself a few days as well because I took my wheelchair, but then I didn't end up using it because we went to a market, and we got told the market was on really rough terrain and everything, and it wasn't as bad as we thought when we got there. So I'd left my wheelchair at the caravan, and when we got to the market I was trying to walk around and I was in a lot of pain. So not only was I in a lot of pain from the market, but the day after I started with my UTI, and I was just really poorly throughout the whole holiday, and it was just really, really bad. And it's took me till now to be able to do my flushes without pain. So I've literally stayed off feed for the whole entire 2 weeks, other than a couple of days that I went on it, which my dietitian's not going to be very happy about because I spoke to her last week while I was away, and I explained the situation about how I'm not being able to tolerate the 20 hours of feed and how like it's really struggling and stuff like that. So she said just do what you can, and then hopefully I will speak to her in about a week and a half's time, and hopefully by then you would have calmed down enough to be back on your normal rate of feed and everything. So I was like, that's really helpful, thank you so much. So she understood where I was coming from. I explained how difficult the whole placement was and how much trauma I had and how difficult it was because they didn't listen. And I remember after I had the procedure as well, you go to recovery, and then after about an hour they send you to another recovery room where obviously you're more, obviously I was alert already, but after go see the people who have sedation, they keep you for an hour, observe you for an hour, then they send you to another room to observe you for an hour until it's time to be picked up. And I just remember like sitting there and the matron was going around, like the matron for endoscopy was going around, and she was speaking to every patient individually, and she was like, oh, I've just noticed that you've got your feeding tube placed. I was like, yeah. She was like, how did you find your experience? And I just let loose. I was like, I told nurses, I told the doctor, I told everyone that midazolam on its own does not work. I have Ehlers-Danlos syndrome. I said, I've had cardiac ablation before. I said, they gave me midazolam for that. I said, it doesn't work. I said, I told them midazolam alone does not work, that they would have to give me 3 milligrams of midazolam, 2 milligrams of fentanyl in order to keep me comfortable. I said, and they didn't even give me fentanyl at all. I said, it was like they gave me fresh air instead of actually any sedation at all. I said, I struggled through the whole procedure. I said, I even tried to tell them that I was choking. They didn't listen to me. I told them I was in pain. They weren't listening to me. I said, it was a very, very traumatic experience and one that I really, really hope I don't have to go through again. And she was like, I'm so sorry. She said, who did you tell? So I told her the name of the nurse that I'd spoken to. That was one of the nurses. I told them that I'd already told the people that had booked me in that I needed 2 lots of sedation. I even told them that local anaesthetic doesn't always work on me because of the fact that I've got EDS. I said, and they only sprayed my throat twice. I said, so I didn't end up with any local anaesthetic on my throat working. I didn't end up with the sedation that I needed. I said, you know, it was really traumatic. So she said, thank you for the input. She was going to go and have a word with people. She asked me what doctor placed it. Now, kudos to my old GI doctor, because when I originally had my first tube placed, he told me that it was best to have sedation, and I said fine, I'll have sedation. I was gonna ask for that anyway. And when he placed my first tube, he sprayed so much local anesthetic down my throat that I couldn't feel anything in the back of my throat. I think he squirted like half a bottle of spray down the back of my throat, and I was so thankful for that. But he also gave me the fentanyl and midazolam, because they know how difficult NJ placements are. They're a lot more difficult than NG placements. And he knew that, so he kind of already knew how much sedation to give me. And I didn't feel a bloody thing the first time I had my tube placed. It was probably the bestest endoscopy I'd ever had in my life. And I was like, wow. So like halfway through this procedure where they placed this one, I was laying there thinking, please just go and get my old GI doctor, because he understands me better. It was like, you know, I know he's like wanted this opinion and that opinion and like a million other opinions, but when it comes to placing NJ tubes, he knows exactly what he's doing, and he would have placed that so much better than what this other doctor had. So yeah, my NJ placement was not ideal. It was very traumatic, and they didn't listen to my words when I told them that I was trying to advocate for myself and explain to them that having Ehlers-Danlos syndrome for some people, especially me, means that local anaesthetics and mild sedation doesn't actually work. So yeah, it's took me 2 weeks to get over my stomach and my bowel to get over the trauma of placement, and hopefully now I will be able to go on my rates of feed and I'll be able to tolerate them better, and things will go back to normal. But I have my surgical consultation in August about having this changed to a permanent tube, which will be placed into my stomach. So I will let you guys know how that goes. But for now, I have my NJ tube placed, and I'm hoping that it stays down and it doesn't do anything damaging, so that I don't have to remove it and have to have another one replaced. And if I do, I'll be requesting my old GI doctor to replace it, because he's a pro at it. This other doctor wasn't. So anyway, I hope you have a nice day. I hope you're having a nice week. It's been 2 weeks now since this placed, so wish me luck at getting my feed sorted. And yeah, hope you have a nice week. Thank you for watching, and if you've got this far, again, I apologise, my videos are so long, but if you've got this far for watching, so thank you, and I'll speak to you again soon. Bye.